Hi, welcome back to Bedroom Brainiacs, adult sex ed for everything you wish you learned in high school. October is Health Literacy Month, so I'm going to talk about the definition of health literacy, break it down piece by piece, and then talk about some special considerations when it comes to sexual health. So the definition of health literacy is the ability to find, understand, and use information and services to make decisions about your health. So breaking it down from the top, the ability to find information. So that means you can find medically accurate, high quality information, whether that's from a medical provider or from the internet or from a book or from the library. And then understand that information. So understand what it is that you're reading and taking in. And also understand the difference between a good resource and a bad resource. And then use that information and services that are available to you. So information might be, again, from a doctor, it could be from a book, it could be from a website, or services, so what kind of healthcare services are available in your community? And then do you know how to get there? Do you know how to make an appointment? So all of that gets wrapped up in health literacy and your ability to find, understand, and use those information and those services that are available to you to ultimately make decisions about your health. And when it comes to sexual health, there's a few specific things I want to talk about. So number one is access. So there are lots of places across the United States that have rules or laws about who can access what type of services or even who can access what type of information. So when it comes to censorship, a lot of times information around sexuality, whether it's health or identity, those are usually the first things to get censored. So if you're a young person living in one of those places and you want to find information about your sexual identity or about your sexual health, and there are laws in place preventing you from doing that, that's going to affect your ability to make decisions. Second, I want to talk about education. So very similar to access. There are lots of laws across the country about sex ed in schools, about education and information and access to education. And those laws can change state by state. They can even change within a state, school district to school district. As someone who has spent time in schools teaching sex ed, you'll be surprised at how different that information is school to school or even sometimes classroom to classroom. So access to information and education can impact your ability to make decisions about your health and also impact your ability to understand the information that is available to you. Last thing I want to talk about is comfort level. So in our culture, we are very uncomfortable having frank and honest conversations about sex. We're uncomfortable using anatomy terms. We're very uncomfortable, sometimes talking about our sexual identity or our sexual activity, whether it's with our partners or our healthcare providers, and that discomfort can lead to some problems. So for example, if you are at a healthcare appointment and you only know slang terms and your doctor is using medical terms, that can create a lot of opportunities for miseducation and misunderstanding and miscommunication. So those three things, access, education, and comfort level, can impact your ability to have a strong sexual health literacy. If you want to build up your health literacy, I would suggest looking for opportunities to educate yourself when it comes to sexual health. That might be just asking your doctor questions. It might be looking for high quality education in your community or maybe on the internet. But of course, on the internet, you should take everything with a grain of salt and do your diligence to make sure that it's medically accurate, high quality information. Something else you can do to support health literacy is that you can support and advocate for policies and laws that support sex education in schools. So hopefully that's going to be medically accurate, age-appropriate sex education in schools and communities because everyone deserves information about their health. And another thing you can do is you can make an effort to learn and use those medically accurate terminology, anatomy words, even if it feels weird, even if it feels unnatural. And look, I get it. It's way more fun to say balls than it is to say testicles or scrotum. But sometimes you're in a situation like a healthcare appointment where you and your doctor need to be on the same page and you need to make sure that your communication lines up and you walk away with a complete understanding so that you can make informed and educated decisions about your health. Thanks for watching.
Hi, everybody. Thanks for watching. Please stay in touch with us by subscribing to our YouTube channel, following us on social media. And absolutely, please comment below and let us know if you have any suggestions for future topics. We would love to hear from you.